Hey guys, for this discussion I had questions 7 and questions 8. Question 7 reads, what guidelines does the book give regarding praying for patients and healthcare practitioner initiated prayer, praying for patients who ask for prayer, or praying for patients silently without their permission? So the book goes on to give a lot of recommendations regarding prayer for patients. I'm going to hit the main overviews, the things that I found important. One thing I did want to highlight before I started was that there's a study that found prayer was the second most common way to alleviate pain following pain medicine in the hospital. So this is something that needs to be addressed and is frequently asked for, but maybe isn't being adequately addressed in healthcare today. So what to do in these situations? The book recommends that praying for a patient is typically inappropriate unless the patient asks for you to pray for them, or you have a long, outstanding relationship with the patient and you know that this is something that they would like and would help them with their care. Bottom line is, if you choose to pray for them, you need to make sure that you're praying for the good for them. So everything's focused on them being healing, or them being cured, them doing better, them feeling spiritually connected with others more, instead of, oh, well, I hope that they find God, or I hope what I want. It's about what they want. So the recommendations, if you are going to pray, or that you always follow the patient's lead. So you don't just march in and take over the prayer and tell them how they should feel. Let them lead. The book goes to a good job to explain how chaplains are trained to do this. So if this is something you're struggling with, this may be something they could help, or you could refer to them to get help. If somebody wants to pray and you're not feeling like you could adequately do it. Regarding patients that ask for prayer, again, bottom line, follow their lead. Go with whatever they want to if you feel comfortable. If you don't feel comfortable and they ask you to pray, the book recommends that you stand in silence while they pray and just be there to physically support them. Or you could offer to get a chaplain, and again, the chaplain can come in and help you guys pray. Book says that you can decline if you want to, but if you are going to decline, you need to provide a valid reason as to why are you declining. You can't just decline and walk out of a patient's room. They will feel very disrespected, and this could be a potential barrier to their care. So just let them know that you don't feel comfortable with it, or it's against your beliefs, or that you would be happy to find someone else that could help them with that. Regarding silent prayers without permission, the book generally advise against this because some clients may not be comfortable with you praying for them without them, but it says if you feel like you need to and you're going to pray anyways, you should follow the same guidelines as for prayers in front of them or with them. So you're praying for good for them, not for what you want, for what they want, and that you are keeping in mind their beliefs and following those beliefs. And if you're going to do this, just make sure that you are not praying for someone that would not want to be prayed for. This relates to me personally. I had experience similar to this in my clinicals recently. I had one patient who had sustained a pretty severe crush injury. He came in post-op and hadn't seen a lot of anything, none of the scar, none of the blood since the incident, so he's pretty traumatized. He came in, he was fearful. He didn't want me to remove the dressing. He didn't want to see what it looked like. He was repeating, like, I can't do this. So I kind of just sat there and talked with them, asking, telling him that would be completely normal to have that feeling regarding something traumatic, so traumatic that had just happened to him, and that asked what I could do to help and what he typically does to help when he feels this way. And he said that he would really like to pray that everything would get better and he would regain function of his arm. And I said, okay, let's pray. And he kind of just looked at me like I was crazy, like, really, we're going to do that? And I was like, if it helps you, yeah, let's do that. So moving on, next question was question 8. What recommendation does the book have regarding their patient healthcare practices that challenge or goes against what you believe is ethical? The book does a really good example of talking about how a patient's family comes in and the patient is on life support, and typically the healthcare team is advising for them to take them off life and support, but the family really strongly believes that there will be a miracle. God will provide their family a miracle, and they do not want to take their family off life support. So as a clinician, the book recommends that you have to honor the patient's beliefs and feelings, and you can't input your agenda onto them. So really, if this is what the patient wants, you need to have a conversation. Let them know all aspects of the care and make sure that is what they want. If this is due to religious reasons, they give some tips, recommendations how to go about this. So the first tip was to acknowledge that science does have its limits. I know as healthcare providers, we don't typically like to acknowledge this, but miracles do happen. There are cases where people have been miraculously healed and science has no reason. So you need to let the family know that you do acknowledge that science isn't always perfect, and that you are not trying to argue with them. Let them know that you're not trying to argue with them. They have their beliefs and you support that. You could work with a chaplain. It would be really beneficial to just get the chaplain, get the family, get everyone talking about what they believe and how you could move best forward from here. And then while you're talking, it recommends finding common ground and seeing if there's any implications that the religious beliefs that they hold, why are they doing this, may affect. So if the family wants a chaplain to come in and pray for them before they do anything, you could help arrange that. Or if there's some kind of ritual they would like to be performed, you could help arrange that. The last tip it really gives is to help the family understand that this decision is not a decision that they are being forced to make. They are not killing one of their family members. This is the decision that is on the healthcare provider, and is a decision that was made by their family member's own body, not by this. This kind of takes some of the guilt off of them. So that was just for that specific example. But in general, ethical issues do arrive, and you may not always agree with your patients, but you have to be able to work with your patients and find some common ground and figure out what the basis of the ethical issue is to move forward. And if sometimes it is, if you can't get to move forward, an impartial legal representative may be a good option to make a decision for someone who may not be able to make a decision for themselves. This story relates to the video that we watched in this class, because if the doctor had been honest and ethical about his care and the fact that he didn't honestly think the experimental treatments would help cure her cancer, then maybe Sarah would have been able to spend her last few weeks here on earth living a more spiritual and more holistic life, where she got to spend time with her newborn and do the things she wanted to do instead of being sick after receiving chemo. Thanks.